Much. Sydney from Busia says, good morning. What happens when a cancer patient miraculously gets well after a long period of being bedridden? Okay. Can you / should get cervical cancer when you are not sexually active? That's another question that's come in. Okay, so we will throw that to Daktari in just a second. But for now, let's start off with our demonstration, even as those texts come in. So, Benda, welcome back. She is modeling as our patient today. And take us through the procedure.
Okay, so I think the Daktari should be the one taking us through the procedure, but I'm here just to show you how easy it is to actually get screened.
Right.
You know, often we talk on studio and often we talk in the community and we say you'll go and get to remove your clothes. I already did it.
Yeah.
You will go and sit on or you lie on the bed. I will be showing you how to do it. And quite honestly, it's such a painless affair. It's such an easy to do. I think it's better to show, Shiko,
absolutely,
than to tell.
Absolutely.
So how about we show?
Let's do it.
Yeah.
All right, Daktari.
Yeah, we'll be instructing the patient to lie down in a lithotomy position. Okay, you can lie down. Remove your shoes with all aseptic precautions we are taking before we start the procedure.
Yes.
Yeah.
And then lie flat.
Yeah.
Right.
Yeah. Usually she has to keep her legs
Raised.
Okay. That's called lithotomy position.
Right.
Then what we are doing, like with the proper light and all aseptic precautions, we are going to clean the area where we are checking, we are taking the samples.
Yeah.
Then this is a speculum, what we call the speculum. So,
yeah, do you want me to help you there?
Yeah.
All right.
Thank you.
Okay. So you've got something called a vaginal speculum.
Yeah.
Okay.
So it's just to expose the area
Right.
where we take the sample. Okay. So this is this we are going to use it with the help of lignocaine jelly, which can make the procedure uncomfortable. Okay, less painless.
Yeah.
So we are going to expose the area where we are going to take the sample. After that is done, it is fixed.
Yeah.
Okay, in this position. Then we are going to open this the pass smear kit.
Yeah.
Okay. So we have what we call as we'll clean that area.
Yeah.
So wherever we are going to take the sample, then this is the speculum. This is the brush. Okay. So which has a part which goes little bit inside the os, and we are going to smear it just like this. Okay. It's a painless procedure, so it is only a little bit uncomfortable, but it is worthwhile doing because it saves life.
Okay. So ideally you're collecting tissue samples with that.
Yeah. After this we take the sample. We are going to slide it over smear it over a slide. Okay. Then which is put in a alcohol solution to fix it, to save it. Then it is transported to the laboratory for the examination under microscope.
Okay.
It's a very simple procedure, which can take around hardly 5 to 10 minutes. Okay. Yeah.
All right. So you had it 5 to 10 minutes.
Yeah.
Slight discomfort, but no pain, Benda. No pain.
Let me simplify it for our viewers, So Daktari has talked about lying on the couch and putting our feet up. When you talk about putting your feet up, of course, it's up and then wide open. But the thing to remember is that speculum is single use. It is not being used with you and somebody else and somebody else. It is yours. And so when you get to the hospital, when the doctor is removing it, you've seen he's popped it open. It is sterile. The second thing is the test is also singular. For each person, it's by yourself. For the third thing to remember is your personal hygiene, really. If you're on your menses, you shouldn't come for a pap smear because it will show a different test. It shall show a different result. But if you're not on your menses, so 5 to 10 days after your menses, you come and get screened. One of the questions that was asked on your text was, what if you're not active sexually? People forget the infection with HPV is the one time. Reinfection is regular, continuous. Even if you stopped having sex, maybe your partner has passed on or you've moved on or you're no longer active, but you've been active at one point or another, the risk of having caught HPV is real. If it hasn't cleared, you still need to get screened. So for women who are beyond the menstrual period, when you're already in your menopausal stage, for women who are no longer married or no longer dating or no longer in an active sexual relationship, please get screened. It's for your health. And for communities overcoming culture, it's about doing things like this, showing how easy it is. Do I look uncomfortable? 5 minutes later, I'm done. And I get back home and I'm happy because I'll know my status. And the doctors are here to ensure that, especially if we find anything, you're treated, you get better, you go back to your family well and good, ready to continue with your life.
Okay. So what do we have here? There's a few apparatus that you came with. Yes.
I would be remiss if I didn't mention this.
Okay.
For the urban woman, that woman I talked about who wears high heels and is uncomfortable the whole day, well, if you want to avoid a speculum test by a doctor, or if your schedule doesn't allow you to go to the clinic for that one test in every 3 years, there is also the self-collection kit. And what we are advocating for is that the NHIF makes it so easy for us to get the self-collection sample, because then you collect your sample yourself in your bathroom. Could be anywhere. If I show you this one, it's a brush that is simply like the other brush that the doctor has shown you, but this allows you to be able to pick for yourself the sample and then drop it to the lab. The laboratory will read the results and then call you in for your results. It makes it so much easier. And self-collection is as easy as stepping on a chair, putting the brush in, twisting it, and then taking the sample and putting it in this container. If you can show me the other one, Shiko. This has a brush and a container, and you're able to put that brush in and take it to the lab in your handbag. And as easy as that, you've been screened. Screening need not be painful, need not be long protracted. It is an easy process, and it saves lives. Go get screened. Oh, and get your daughter vaccinated.
All right. So as we wind down, I want to ask my director if we have a minute or so. Bona Director, Abu, if we've got any text messages as well that you'd like to forward to me, let me know before we just wind up. I think we have a minute or so. Yes? Okay. Dr. What about the question that came in? Especially when it comes to the issue of what happens to a cancer patient who recovers. Are we seeing cases like that, though?
So there are still chances of recurrence. Okay. It's good to do the pap smear and the other regular clinical follow-ups. Just to detect still in early stage, so it can be salvaged. It can be treated well.
Okay. Benda, why don't we wind up with the conversation around culture? Herbert is actually talking about, what's happening in his area. He says in Taveta, the issue of culture is still with us. How can we bring change for a better and healthier society?
I'm conversant that the government has invested heavily on screening. When Dr. was talking about the modalities of screening, there are two he mentioned, HPV DNA testing, as well as pap smear. There is a third one which is called VIA, and that's available in every public hospital in Kenya. It is available. We have organizations such like the Kenya Network of Cancer Organizations, advocacy agencies like ourselves who go to the community and talk about cervical cancer, demystifying. And I know in Taita Taveta we have some organizations there. If you hear this message, tell someone. It's easy to detect and prevent. It will come from us talking, normalizing screening, and getting women to actively go seek treatment. And the thing is, even as we go for screening, COVID-19 or not, we know the hospitals are taking measures. You'll find stations to wash your hands. You will find the doctors waiting for you, the nurses waiting for you. Talk about it. Let's get cervical cancer out of our space. It can be prevented.
Okay.
Yes.
Another question here says, if one is sexually active, is it just simply safer to just use condoms than actually come up with an alternative? Okay, so contraceptives as a concern here. If I just stuck to the contraceptives, why bother going for your test?
Contraception prevents pregnancy. It doesn't prevent cervical cancer.
Yeah.
Cervical cancer is prevented through screening for early detection and HPV vaccination. And using a condom,
Yeah.
while it may work to prevent the HPV getting into the canal, it will not prevent body-to-body contact with the rest of the area around the vagina as well as around the penis. So it's important we get these conversations out there.
Okay. All right. I think we will wind up there, but finish off with Dr. letting us know what is available to our viewers in regards to screening during this particular month as we talk about cervical cancer awareness. What can I expect, even as far as telling us the charges that we should encounter?
Yeah. We particularly for screening, we do a lot of screening activities in here at our center, HCGCCK Cancer Center, as well as in MPSHA. We do regular pap smear. Here we are doing every weekend, but on Saturdays we do free pap smear for the ladies. Okay, so that is one thing. The HPV testing is not routinely done. So as she told, so in other district hospital, what they do is we call it as via Willy test. Okay, so we usually do it after 30 years because there are chances the patient cannot come for follow-up. What we do in via Willy, we visualize it's more similar to pap smear.
Right.
We inspect the cervix with some solution, via through acetic acid or Lugol's iodide. So we see abnormal areas, and sometimes when it is very difficult to follow up, we take a small piece. We do the procedure at the same time.
Okay.
So that's why it is important. And otherwise, we do a lot of clinical examination and pap smear, as I told, and even for the we can do, if there is an obvious mass or anything, we can do a biopsy. We can take a piece and we can send it to the lab.
All right. Well, thank you so much. Bless you, Dr. Adarsh, for taking time to be with us and also explaining what is available to our audiences. Benda, we cannot thank you enough for pushing the message every single time you come to studio about getting women to just be proactive about their health, and of course the men too. Yeah, right?
I need to add, it's only the prevention aspect. The cervical cancer is preventable. Even the response wise, the treatment wise, the survival wise, the response is very good with cervical cancer. So even we have stage 1, we have the 100% people can live for 5 or more years.
Right.
Stage 2, 80 to 90%. Stage 3, we have still 50 to 70%. Even in early stage 4, we have 4A and 4B. 4A is when it has spread to the bladder and rectum. Still, we have 20 to 40% who can live for 5 or more years.
Wow, and that's a message of hope right there.
Even stage 4B, they can also live up to 5%. They can live up to 5 or more years.
All right. Well,
so very good. Like it has got very good treatment response.
Okay, all right. So obviously in the event that you are not able to access a facility such as this, please go as far as taking or at least checking in with a local facility near you. But the message is clear that, of course, testing and screening matters. We wish you all the best, and of course, blessed day up ahead from all of us right here at the MP Shah Hospital and the Cancer Center. Thank you so much for watching, and of course, on behalf of my crew and the breakfast team, asante sana. Have a blessed day up ahead. Bye-bye.